I don't believe, there you go.
Thank you. This legislation takes one more step in the right direction to ensure prescribers of opioids are held accountable for their prescribing practices. According to the CDC, the amount of opioids that have been prescribed and sold in the United States has quadrupled in the last 20 years. Yet the overall amount of pain Americans have reported has not changed. In 2013, healthcare providers wrote 249 million prescriptions for opioids to treat pain. That's enough prescriptions to provide every American adult with one bottle of pills. And in fact, in one of my counties in Indiana, in Madison County in 2016, 110 opioid prescriptions were written for every 100 residents, so even more than one, according to the CDC. One way we can reduce the prevalence of opioids in our homes and communities is to equip prescribers with the information and education necessary to ensure good prescribing practices. This legislation, which I've introduced with my colleagues, Mr. Welch, and our colleagues on the Ways and Means Committee, will require CMS to establish a threshold for which a prescriber would be considered an outlier opioid prescriber. CMS would then be responsible for notifying outlier prescribers of their status and providing them with information on proper prescribing methods. In order to ensure accuracy, this threshold would be established in consultation with stakeholders and would take specialty and geographic location into consideration, a process modeled after the comparative billing reports that CMS successfully released in January. Ensuring prescriber education regarding the risks of opioids use, alternative treatments for pain and addiction, will change the projection of this epidemic, and the ability to identify and notify healthcare professionals who overprescribe opioids and provide them with information on proper opioid prescribing practices is one more step forward in our goal to end this opioid epidemic. I look forward to working with my colleagues to ensure practitioners have the education necessary to utilize proper prescribing practices and better pain management techniques, as well as adequately identify and treat patients who may show signs of drug misuse and addiction. I believe this is one more important step, and I hope we continue to focus on and continue to discuss ways that we can continue to educate more prescribers about opioids. With that, I encourage my colleagues to support this legislation and yield back.